I'd like. All right, good afternoon, everyone, and I'd like to welcome you to the February 14th meeting of the Milwaukee Mental Health Task Force. I'm Mary Newbeller, one of the co-chairs, and I will be co-chairing solo today because my co-chair, Dr. Christine Apple, is out of the country. So I'd like to go over the meeting ground rules. And the ground rules are that everyone will be muted throughout the session. We hope to have time after each speaker for a few questions. Use the chat feature to type your questions and we'll answer as many as we can. Sign language interpreters are provided at this meeting. If you need assistance accessing the interpreter, put your request in the chat. Speakers, please state your name before you speak to help with accessibility. Auto captioning is provided, and you may turn captioning on or off. Click on the caret symbol next to the CC Live transcript button if you want to hide subtitles or to view the full transcript. And at the top of your video screen, you can choose between speaker view or gallery view, whichever you prefer. So next on the introduction is that we ask that you please complete the Mental Health Task Force 2023 program survey. There is a link that is in your meeting materials, and it is with that program survey that we are putting together the agenda and programming for this year. So your input is greatly appreciated, and there's opportunities to write things in, so please do that. Our March meeting will include a briefing on the state budget, which will be introduced, on March 15th.
And Mary, I'm sorry, that was my mistake.
February 15th, I'm sorry, February 15th. And we know it includes many positive investments for mental health services, as the governor has made it the year of mental health. And watch our listserv for updates that Barbara will provide. And remember, the Mental Health Task Force annual membership drive is still open, and the membership drive letter is available with the share link from Barbara in the Mental Health Task Force materials and on the website. Don't forget to vote in the February 21st primary for Wisconsin Supreme Court. The new justice will have many deciding votes on cases on the rights of people with mental illness, voting rights, redistricting, and much more. And you can see the resources, on page 2 of the voter toolkit that's provided in the link. And note that all meeting materials are posted on our website at the link included in the agenda. And now I would like to take the pleasure of introducing our first speaker, and that is Jeremy Triblett. And Jeremy is with us today from Milwaukee County Behavioral Health Services. And Jeremy is the service coordinator, the prevention service coordinator. And he's going to talk about harm reduction and prevention vending machines today. And this is really important to the Mental Health Task Force, because one of the things in this vending machine are the fentanyl test strips that the task force supported in the 2022 Karen Avery Forum. So Jeremy, thank you for being here with us today, and take it away.
Yeah, thank you, Mary, for introducing me, and thank you all for having me. It's been great to finally get this project to the place where we can accept applications. It's been a long time coming for this, and it's really been a labor of love on behalf of the county to implement a strategy that has been adopted really nationwide, certainly in the state of Wisconsin, relating to having vending machines that increases access to harm reduction and prevention supply. So I'm going to walk you all through specifically the application itself, We want to walk through that application. It does a great job of introducing this project to the public. And then I'm going to take some questions related to how you all can partner with us afterwards. All right. So at any point in time, actually, if you want to just kind of step on in and raise your hand or put a question in the chat box, I would love for this to be a conversation as well. So when you first get your application, I want you to know that there is an information packet, which is essentially the first 4 pages of the application, right? You can have that separately, but you can also have the fillable PDF version of the application, wherein you can type after you download it to your computer into it and then email it to me. But then you can also get the electronic version of the application, which we just translated everything over to Microsoft Forms. And if you're more comfortable using an electronic version, you can use that as well. So our intention here is to try to make it accessible via paper version and or online in Microsoft Forms. All right. So when you first open it up, you're going to see this opening page here. It actually goes in depth around the funding source. Shout out to SAMHSA and SOAR funding for really helping us be able to make this happen. We also give you a little bit about the need statement, particularly looking at overdose deaths between 2016 and 2020, and 2021 looking at fentanyl being found in 508 of 644 drug overdose deaths as well. We really wanted to make sure we understood that this particular project really was an answer to one of the many answers to the rise in overdose deaths. The initiative overview is that according to SAMHSA, harm reduction is critical to keeping people who use drugs alive and as healthy as possible. Behavioral Health Services of Milwaukee County Department of Health and Human Services will partner with Vivint Health's LifePoint program and HRI Vending to increase Milwaukee County residents' access to harm reduction and prevention via vending machines located in businesses and public buildings across Milwaukee County. Interested parties are encouraged to complete the application to host a vending machine as a free resource for residents in their local communities. I do want to say at this point, we have 10 applications that have already come in, and we've only released the application just last week. So we're off to a really strong start there. And we're really excited about folks really embracing this project as well. You can also find on this page the initiative overview. It begins with saying, listen, here's very plainly what we plan to put in our vending machines. We want to put the Terra deactivation bags. Those are really pouches that come with a solution that deactivates medications you no longer want. And so the idea here is that we can do a great deal of making sure people aren't getting access to old medications or flushing them down the toilet or harming the environment. If they take this pouch, add their medications, add some water, shake it up a little bit, it deactivates it, and they can put it in the garbage can. That's really exciting because there's a lot of folks who may not know where to go and dump their medications. They may be using outdated practices or something like that. It's really cool that if you don't have access to transportation or moving across the city isn't something that is easy for you, you could just stay at home and really dump those in your garbage can. That's really cool. So that's exciting. That'll be in the vending machines. The next thing that'll be in the vending machines is medication lock bags. There's a lot of folks who may have medications they are using around the house. Maybe it's in your nightstand or under your bed or in your purse, right? These are places that are usually not locked, and other folks may be able to get to them. If there's people who are living with substance use disorder, they may be tempted to get to those because they're much more easily accessible. Well, we're looking at that and going, okay, well, why don't we provide medication lock bags to the public? And so every vending machine will have a lock bag. And I like the cool thing about this is that it'll have 2 ways to lock your bag. There's a 3-number code you can put in, and there are 2 keys you get as well. So you can lock up all your medication and keep that where you want to keep it. And it reduces the likelihood that somebody without your code or who doesn't have your key will be able to use your medications without you knowing it. And so that's exciting as well. The next three things, or the next two things we're looking to put into the vending machines are gun locks. We recognize here at the county, and we actually do a lot of work related to suicide prevention as well. And so if there are folks who have guns in their homes, it's going to be important for them to be able to lock those up, right? And we know that when we lock up our guns, we have it creates a barrier between what you plan to do with the gun when you have to unlock it, right? So those few seconds of just unlocking your gun can be seconds that'll help you make a better decision if that is the case. We also have nasal Narcan. We know that particularly fentanyl is being laced in many different kinds of drugs, especially opioids. And so there are folks who are dying from fentanyl, and nasal Narcan has been proven to be able to reverse an overdose. And so that's going to be in the vending machines as well. You're going to get the box with 2 nasal Narcans already in it. And then lastly, fentanyl test strips as well. If folks aren't having an overdose, but they are still using drugs, this is a great harm reduction item, because what it does is it allows folks to test their own drugs before they use that drug, right? And so we'll have those test strips as a kit. It'll include those water vials as well. So yeah, those will be the items in the vending machines. What's going to happen is, as we select agencies to host a vending machine, they also have to come on as an education partner. We're going to provide pamphlets and posters all around the vending machine so that folks are educated on how to use them. We're also going to train each agency for free on how to use every last thing in that vending machine, including how to work the vending machine. And so this is going to be an agency's opportunity to invest in their staff professional development as well. And so that's really exciting. The third way we're educating folks is we're organizing community educators because we want to, whenever we place a vending machine, we want to disseminate folks who are going to walk around house to house, door to door near that location and tell folks that the vending machine is here. That's super exciting for us to really meet that community and say, hey, if you know someone or you are someone who needs these supplies, please know that it's at this friendly location, and they'll get a map of that, and they'll be able to get trained on how to use those things as well. So we're really thinking through ways in which we can educate folks on how to use these products before they get vending machines, and while those vending machines are there. The last piece to this I want to mention is we're working in partnership with Vivint Health, to actually say, hey, we need a website, right? So they're planning a website where you can actually get many of these products and others shipped to your house, right? So we want to make sure people have this in so many different ways so that we can increase access. Once we increase the access, we'll begin to measure the impact these things are having in specific neighborhoods over at least a 3-year period. So we're really excited about that. That's really an overview of this project, and we can go a little bit deeper into the application. Before I go any further, though, I want to ask you all if you have a question for me.
Jeremy, I do see, this is Barbara Becker, that there is a question in the chat from Denise Johnson.
Yeah.
And Denise asked, is there a cost to people who need the strip from the vending machine? How exactly does this work?
I love that question. So the vending machines are completely free, right? They don't even have a thing where like it counts the coin and stuff like that. There's no dollar receiver. I don't know what it's called. There's no technology. There it is, to actually receive money on these machines. Right. We are having lots of conversations around, number one, like I said before, how do we measure impact of these supplies being more readily available? And number two, we're also thinking about ways in which we can make folks feel safe at the machines. Some people in other counties and other cities have even implemented video cameras because the public itself said, hey, I feel safer in this particular space if I know like there's a level of security around me somewhere. We can also use that as a mechanism if necessary to say how many things were taken by a certain person if there's a whole bunch that goes away from that machine. The last piece we're doing is we're having the agencies, we'll be partnering with Vivint once again, to hire a full-time person to manage the vending machines as well. And so they'll be there to make sure every vending machine is restocked, but they'll also work with staff at every hosting agency to make sure they understand, how to manage that stock. They understand how to educate the public about that stock. So we're getting someone who's going to work on this full time, y'all. It won't be a collection of people coming together, just kind of borrowing time. We're going to have a central person dedicated to it. And then that person is going to really be the liaison between us and the hosting agencies. But yes, everything is free. Great question. Are there any other questions?
I had read through the information. Does the agency have to have the machine available, of the vending machine have access 24/7?
We can't make an agency stay open 24/7. So the long answer to your question is these machines have to go inside because it's more temperature controlled.
Right.
Members of Narcan can't be outside, obviously, right? And so for that reason, we have to comply with agencies' time of business. So there will be, hopefully we get folks who are open 24 hours a day. And then we also get folks who may be open at other hours of the day as well. But we wouldn't be in direct control of how long folks will be able to give people access to it because we don't control their hours of operation.
Thank you.
Really great question.
This is Barbara again. We have some other great questions, and I will read both of them and then let you respond, Jeremy.
Sure.
So the first one is a question from Sue Goddich, wondering if you will place vending machines in locations without a host application, and she gives libraries as an example. Great question. And our second question is from Maria, asking if machines are 24/7 and how they will be protected from vandalism.
Nice. So we purchased 25 machines. I'll answer the vandalism question, and then I'll answer the hosting question. We purchased 25. We hope to disseminate all of them over the next 3 years. This year, we plan to start with about 7 or 8, potentially. One of the ways we've thought about vandalism is cameras, also the hosting agency being able to report on those things as well. And then you're bringing me to my next point, which is our partners, because HRI Vending is going to be doing needed maintenance for the machines throughout the year. So anytime there's something happening to the machine, we're going to partner with HRI Vending to fix the machines. What we won't do is guarantee that there won't be vandalism. So what we did was we built in the cost to actually repair machines in any way that we can. We anticipate, I always tell folks, we anticipate the greatest things are going to happen, and we also anticipate the worst things are going to happen, right? That's just the nature of this project. And so if there is vandalism, we do have a system in place and the resources to make sure we can handle that in a timely fashion as well. We do offer examples of people who can host a machine later on in the application. I'll get to that question when that comes up. All right. Oh, and I can actually see the chat box as well. Restricted schedule, but shelters or bus station, Amtrak. It truly is. When I tell folks we don't have a line in the sand about who can't host it, the intention is to get everybody who thinks that they may want this because they know they have foot traffic and they know that their community is impacted heavily. We want all of those people to apply. And the process is going to be, when you actually apply, a part of that process is going to be us interviewing and even coming down to your location and being like, where would you have the machine, right? How many people come through here all the time? We want to make this a grassroots process that requires us to partner with agencies. After we get done interviewing folks and going to places, we may say, you know what, that's not a good fit. But the agency and us will be in agreement with that. We'll be able to say, yeah, that makes sense. Maybe because there's 4 other vending machines in a 5-mile radius, or you know what I mean? Like there's different dynamics that go into play. And what we don't want to do is, for lack of a better term, pigeonhole ourselves into a process that isn't necessary or helpful to making good sound selections. So the intention is to really be in community, making the decisions based off a number of factors that first begin with agencies having the capacity to host them. So, Kelly, are you asking if agencies outside of the city of Milwaukee or the county of Milwaukee?
I was thinking maybe either. Like I was specifically wondering like Waukesha County, because I know they also have some struggles with overdose.
Oh, so this is only a Milwaukee County project. All, I think it's 18 or 19 municipalities can apply to have a vending machine within Milwaukee County. We wouldn't be able to service anyone outside of the county. Great question. Y'all are firing off with questions. This is awesome. All right, I'm going to keep going into the application. Maybe some additional questions will come up and others will be answered. So HRI Vending, once again, they will be doing free trainings to the agencies to tell them how to use the machines. They'll be offering service calls to the machines throughout the year, and they'll even consult with Vivint about where to place the machines and us as well. So they have wisdom about vending machines that we're getting from them. We will store the machines ourselves, so we have those machines in our possession. We'll also be the ones coordinating between all of the partners. We'll also be the ones managing the public communications, including figuring out what the posters and all of the resources should be around the machines, and all the equipment related to that. Vivint will restock the machines via their prevention specialists that we plan to hire, and track the vending machines, making sure that they have all the supplies that they need, and then they will report on the percentage of items that have gone from the machines each month. Okay, Denise Johnson, I see you. What's your question?
Sure. I wasn't sure if this is a good time to ask, but
It always
here,
is. Go ahead.
it just came to mind. So with the vending machines, I'm just trying to imagine what they look like, because if I'm a person that would need, let's say the fentanyl strip test or test strip, and maybe the area is not near where I live. So I guess I'm trying to imagine if I receive, if I get something, okay, you were talking about the temperature needing to be at a certain, we can't just leave the vending machines outside. So if somebody just picks one up because they never know if they're going to need it and just stays in their bag, like how long would it stay good and those kinds of things. So I'm thinking about the end user and how will they know how to properly use the equipment.
That's beautiful. So the first thing is at each machine, there's going to be ample resources and posters saying if you're going to get nasal Narcan, for example, or fentanyl test strips, here's how you use it, and in the most really simplistic, plain language, multiple languages. And then we're also going to have quick notes or quick facts, like, here's check the expiration date on the box you have. Make sure it's not left outside in the cold. We're in Wisconsin or in the heat in the summertime. Tips about how to store those things. They can also always ask one of the employees at the agency and say, hey, what do I need to know about this? They're going to be very helpful, willing, and able to educate folks on that information as well. All right. We'll also have a website in partnership with Vivint that actually has that information on it as well. So hopefully that gives us that answers your question.
Yes, it does. Thank you.
All right, perfect. All right, back in the chat box. Will HRI do preventative maintenance on the machines? From Mary. I'm not sure if, like what? What were you thinking there, Mary?
Well, what I'm thinking is, are they only going to go out to machines that are broken down, or are they going to go and, because maybe machines aren't breaking down, but are they going to go check machines to make sure they're adequately whatever, I don't, is it, it's a mechanical machine, so, is there an alignment in it that has to be correct so that they don't break down or whatever? So are they gonna do they have a contract just to fix broken machines or to prevent machines from breaking down?
I see what you're saying. Thank you for that question. So
Uh-huh.
the first thing I learned when I was working with them is the vending machines, particularly the ones that we're getting, because they don't have electronical technology and stuff in them. Once they're delivered, they should be fine, right? So the vending machine industry knows this kind of stuff. And so I was really reassured in that regard. And that if there is a fix that needs to happen, they'll just come out and do it. And so they're already sent working well, working how they should be working. Folks at the agency will get trained. I'm going to get trained as well on how to adjust something if something needs to be adjusted. But it should literally be the most minor and minute adjustments that the person being trained should be able to walk up to the machine and go, oh, okay, let me switch this knob thing here. Like it's actually really simplistic. That's exciting because it tells us that the technology that we chose is accessible and user-friendly, right? And so that's why we put in place folks being trained on how to use it. They may get out to the training and go, wow, they could have emailed that. No, we want to make sure it's in your face, you're at the machine, you're clicking the buttons or you're flicking the switches to make sure you can kind of get a more intuitive sense of how to use it and how to fix those things. If anything beyond a quick, easy fix that a trained staff would need, then we'll bring folks out. Oh, look at Nicole, I love your question. Okay, so we have been thinking about having some sort of like tablet at the machine. That's going to be a little bit more long term because first of all, tablets are much more, if we talk about vandalism, you got a tablet that sits there all day, it's much easier to steal a tablet than a vending machine, right? So we have to think about, okay, how do we secure that? And then the question becomes, how do you have a rolling video? Because we wanted a rolling video that goes through everything in that machine constantly. And we haven't given up on this dream, except what we would have to do is
Can I say with captioning if you do any video?
Oh yeah, all the things, right? All the things, captions, multiple languages, we love that. One of the things we're running into is, in order to do that on a tablet, we found that we would need the Wi-Fi of the building. And so there's a whole technical thing about if the Wi-Fi goes out, what happens, we don't have backup Wi-Fi, there's all the things. So we're still working on that. We're going to start with paper. Unfortunately, that is the piece of it to start with in limitation, but we're going to have people speaking about it as well. Yes, Nicole, thank you. I was going to get to the next point, but we have been thinking about tablets. The other thing we've been thinking about are QR codes, and Jen Whitmer would love that we're talking about this. And so if people have phones, they will be able to use the QR code at this point to look at a video that verbally explains it with captions. We also recognize everybody don't have a phone, right? But as much as we can eliminate evidence-based user errors, we will. We're going to start with the flyers and the posters. We're going to have a big old QR code on like everything, and you'll be able to get it from there. But that's exciting. I love that y'all are thinking how we're thinking about it. Okay, thank you, Maria. Are you going to have an app with all machines located in case one runs of supplies? Ooh, that's good. Now, in my experience with apps, Maria, and that was about 6 or 7 years ago, they're a little bit harder to manage, but maybe I'm sure there's software you could build apps on or something like that. We haven't gone as far as the app internally with that conversation, Maria, but that would be cool. We've always gone as the QR code to Nicole's point. The other thing we thought about was like, how do you see where they are like near you and stuff? So we'll definitely do a marketing campaign where, you know, the QR code on buses and stuff like that. Yeah, we're also, one of the things I learned with apps though, Maria, is that The intention is for folks to download it, and many times people offload apps that are super specific and need-based in favor of apps that are more around social media and entertainment. And so one of the challenges people always have when they make apps specifically for these kinds of things is that people will download it and then take it off their phone oftentimes. And so it can become very hard to figure out the value of the app when it keeps going on and off the phones. And so, but nothing's off the table, y'all. We're literally saying we're going to start with meeting the problem where it is. And every year we're going to try our best to improve this project as much as we can, so that at the end of the 3, hopefully the next 10 years or whatever, we'll be able to say, hey, here's how this project has grown and evolved, right? It will continue to grow and evolve. So apps are definitely not off the table. Do a lot of big photo visual instructions would be helpful too. Yeah, Denise, we're going to do that as well. Photo-based instructions. I love that. When I go to a restaurant, I need a menu to have pictures of the food. I'm a visual person. I love when things have visual steps. I'm going to take one more question in the chat box before I move forward, and then I'll come back to a round of folks speaking. I also want to check in with Barbara. Am I taking too long? I feel like I'm taking a lot of time, and we haven't gotten through the whole application.
I think that we have, let me just look at the agenda to be sure, but I think we can go until 3:40. So that gives you about 5 more minutes
left. Yeah.
Okay. All right. Barbara, thank you for that note about Independence First. I will call them and consult with them related to some of the accessibility pieces. Thank you. All right. With 6 more minutes, I'm going to walk you all through the pieces of the application that are really going to be important. So when we talk about hosting it, right, you're going to find that we're asking for these things to be true about your agency. We want you to be located in Milwaukee County, as said before. We want you to maintain the vending space so folks feel like they can actually go into it and it's easily accessible. We need you to have adequate space, not just clean, but enough. We even tell you how much space you need to host a vending machine right there, right? We also want you to be a community agency that has experience with engaging your community, especially around educating them on stuff, right? We want you to communicate with us as project partners really well, manage the supplies and partnership with us. We also want you to get a letter of support from somebody else in the community. These first things, most people think about as top of mind, right? So the list looks long, but most of these things people act anyway when you have a brick and mortar location, right? So we recognize that. The pieces that may require a little bit more time, it's just that letter of support. We want you to think about who from our community would love to see us host it, and then have them write your letter of support. We don't have a template for that or nothing like that. We just tell folks that email me your letter of support at jeremy.triblett@milwaukeecounty.wi.gov. And we just look forward to you all figuring that piece of it out. We just want to make sure somebody else in your community is aware that you're embarking on this and they can validate that you will be a great partner for this project. And then also be willing to attend free training, y'all. Okay? Hopefully that's not a heavy lift for folks. We want to make sure they are really accessible. And so we'll be offering those monthly, but then you can also request them from us if that makes more sense for your staff. So those are the hosting criteria. And now we're going to move into the actual application. We do ask folks to fill out their agency information, the executive director, and then the initiative contact if that's different than the executive director. Sometimes folks may assign a person. We want to know who that person is. Lastly, we try to think of all the places that would possibly want a vending machine because we really aren't picky about it. We really want to make sure people know that we're looking for any and all spaces, right? And we'll weed them out as it makes sense. So we got on here nonprofits, that's very broad. Gas stations, motels and hotels, libraries, private firms, stores, restaurants, schools and universities, religious organizations, government agencies, community health centers, food pantries, and you can just write in what kind of agency you are and let us know, right? And then making sure you check off that you will provide at least a one letter of support. And then if you want to, a floor plan. Here are the questions. The first one is, where in your building will you place the vending machine? Second question, when will individuals be able to access the vending machines? We asked that question around that too. How would you describe the populations your agency currently serves, right? Maybe you serve, I don't know, lawyers, or you only serve people in your, 10-block radius. We want to know, who are you serving? But then we also want to know, how many people do your agency serve annually? We really want to know weekly, monthly, daily. Give us a good sense of that, okay? Why do you feel a harm reduction and prevention vending machine would be successful in your agency? How would a harm reduction vending machine address the needs of your surrounding community? What other behavioral health, harm reduction, and prevention strategies, we give examples, and businesses exist within a 1 mile radius of your agency? We want to see that you have a good sense of what's happening in your community and that you're aware of all the different businesses and strategies going on. And then we want to check off the prevention and harm reduction items you've disseminated, purchased, or promoted in the past. It won't work against you if you've never done it before. We hope that agencies who haven't done it before apply. We just want to know and get a sense of, if you ever have, right? And then lastly, how will you promote the vending machine and harm reduction and prevention applies to your customers and residents around your agency? And so that gets at the piece around you taking on the leadership of letting folks know that this is near your location. So that is the application. I think I literally have 1 minute left. So I guess I should go with what's in the chat box currently and try to answer them as fast as humanly possible. Okay. I am doing a mental run if I need to get stuff, not a question. Okay. Do agency or businesses who get vending machines get any benefit for having it at their site? Beautiful question. We do not have any benefits for the agency having it at their site currently. So yes, we don't have that at this time. But that's a very equitable question. Jeremy, thank you all. Very engaging. Oh, thank you. Will there be a conflict to have these machines in pharmacies like Walgreens? Yes. I would imagine. I would imagine that there would be a conflict. We haven't thought extremely in depth about if those agencies who are directly associated with contributing to the opioid epidemic had this in their agency, what that would mean. If that comes up, though, we will have internal conversations and come with a unified response to make sure folks understand why it is, particularly, for example, a Walgreens wouldn't be able to host it. All right. Hopefully those answered all your questions. Thank you all so much. And I guess I'll turn it back over to Barbara or Mary.
Jeremy, I had my hand up a while about a question. My question or my comment is whether you can work with Milwaukee County Transit to use their electronic banners inside the buses to identify locations where machines may end up.
Oh, that's cool. Thank you. I will do that. I'll reach out to them.
Okay, thank you, Jeremy, very much for presenting to us today. Okay, Pete, you're up.
Okay, thank you, Mary, and thank you, Jeremy. That was amazing. Our next presentation is support and empowerment of youth. And quick background before I introduce our two speakers, DeShanda Clark and Audra O'Connell. This is a second follow-up to our Karen Avery forum from November, which focused on parents and families experiencing or risk of being involved in child welfare system, looking at supporting parents with an empowerment and strength-based and race equity approach. So the Karen Avery Forum that started this featured Rise Magazine executives or leaders, Rise Magazine in New York gives voice to parents directly involved in child welfare and advocates for peer support. We also had veteran parents from the Children's Court Drug Treatment Court that works holistically with parents. Then the next follow-up was to look at resources and programs directly based on supporting parents through providing resources and strength-based approaches, including Brigida Wilson from Department of Children and Families as a lived experience strategic advisor, Keisha Shanks from who was the policy director of the Black Child Development Institute, Christine Ulstrup from Maida House, the Vice President of Clinical Services and part of our task force steering committee, and Lauren Folds, who coordinates housing and other resources for the Healthy Families Program at Community Advocates. So a connected issue with this is the issue of teens who were involved with the child welfare system or foster care system, or otherwise have had their lives affected by trauma and homelessness. So this is connected to those things, and we may have further exploration of many of these topics having to do with families and children and youth. So with us today, DeShanda Clark, who's the Vice President of Programming Services for Pathfinders, a well-established organization that serves young people, including supportive housing, shelter services, street outreach, school and clinical services. And DeShanda was also the 2020 recipient of the Mental Health Task Force Maurice Perry Rising Leader Award. Audra O'Connell is Executive Director of the Walker's Point Youth and Family Center. And Audra has been working in that capacity for 7 years. And before that, she worked on issues of homelessness for a total of 14 years. So I'm going to not take up any more of their time because we have a lot to pack in here. So turn it over to DeShanda and Audra right now. Thank you.
Thank you, Pete. I'm going to see if I can share my screen. All right. Give me just a second here. All right, there we go. So I'm Audra O'Connell. I'm sorry, for some reason my camera's not working, but hopefully you can all see my screen. I'm here to talk specifically about Walker's Point, and then DeShanda will talk about Pathfinders, and then together we can, answer any questions you may have. So just a brief agenda. I'll give you a mission and brief history, an overview of our programs. Pete asked us to talk a little bit about problems that we've seen really for us since COVID. Then some mental health expansion that's on the horizon for us. And then also some call to action. So I won't go through all of this. You have links to this PowerPoint. But really, we've been around since 1976 when we were created because there was a homeless youth shelter on the north side of Milwaukee, but people felt very strongly that there should be a presence on the south side of Milwaukee. And so two youth outreach workers from the south side started Walker's Point, and by that year's end, they had served 213 youth. We purchased the shelter that we are currently in back in 1981. And then our housing program for young adults began in 2002. And so really there are three main pillars of the work we do. We have our emergency shelter that's located on 21st and National. It can accommodate up to 8 young people at a time. One of the things that is important about the work we do is we are the only youth shelter in southeastern Wisconsin that will take parenting teens and their children. So if they have a baby, they can come with them and stay in shelter together. Young people can stay up to 21 days, but on average, they stay 5 to 7 days. Prior to the pandemic, we were serving 200 plus, really around 250 young people in the shelter. 92% live below the poverty line. 73% identify as African American, and 27% identify as LGBTQ. We look at a lot of metrics when they're staying in the shelter. We have 2 licensed professional counselors, one of which is Spanish speaking, that is embedded within the shelter. And they meet with them 7 days a week. And so we look at a lot of things when young people are leaving the shelter. And one of the metrics is, when they're leaving the shelter, do they feel better able to cope with the problems that made them come seek help? And this last year, 89% of them said yes, that they did. Our mental health clinic started within our shelter, but very early on, we realized that there should be some availability to have mental health services outside of being a shelter resident. So right now we have 2 licensed professional counselors on staff and anywhere from 3 to 8 graduate level therapy interns. One of our counselors, like I said, is bilingual. The expectation, if you are in shelter seeking services, is that you're participating in group, family, or individual therapy 5 days a week. When young people leave the shelter, we are doing check-ins at 1 week, 30 days, 60 days, 90 days. However, when they leave the shelter, if they would like to continue their mental health services, we can continue those services up to 6 months. If they are 14 and over, they can self-refer for mental health treatment. So if you are a 14-year-old and for some reason your parents are not consenting for you to seek that treatment, you can self-refer and get access to therapy with us. Our therapy is completely free and we do not bill insurance. And our counselors will serve non-residential youth. So we have about 100 per year that we're serving that are young people that never came into the shelter. And we filled about 1,600 crisis calls a year. And so a crisis call can be anything from, you know, I need access to therapy services to as simple as I don't have enough food in my house. Can you help me out? We also have a housing program. We have the Insights housing program that's been around for about 30 years that serves 18 to 25-year-olds who are experiencing homelessness. It's an intense intervention to prevent that further chronic homelessness that we seem to talk a lot about in Milwaukee. The thought is that if we are going upstream to younger people who have less length of time being homeless, and we're providing that very intense case management and rent assistance, that we can alleviate that homelessness and help to ensure that they don't come into the homeless system as older adults. 90% of our clients maintain their housing upon completion of the program, and that's looking at 2 years later. Are they coming back into the system, or are they maintaining? We have 3 case managers, each with over a decade plus experience in human services, and one is bilingual. Currently, they can work up to 12 clients each with their dependent children, but right now they're doing 9. We provide up to 24 months of rent, security deposit, basic needs support, case management. And to put it in perspective, there are 200 young people on the waiting list trying to get into this program at any given time. So in terms of when Peter was asking me some of the problems that we've faced, really coming out of COVID, calls for non-residential therapy services for 11 to 17-year-olds have just skyrocketed. We have maintained a waiting list for the past 1.5 years of trying to get young people in for therapy. And really the biggest issues we're seeing are that parents and caregivers are having difficulties finding child or adolescent therapists that are accepting new patients and accepting Badger care and are accessible. Many of our youth face cultural and family barriers to seeking therapy, especially when we're talking about young people who are dealing with sexuality or gender identity issues. But there's also some issues that we found in transportation to access services, especially when you're talking about homeless youth. Trying to get them to be able to find a way to get to a therapist can be rather difficult. So because of all of that, Walker's Point is entering into 2 different partnerships. One is we're entering into a partnership with Milwaukee Christian Center to embed a licensed professional counselor in their youth development program at Kazi Community Center, as well as at Forest Home Avenue School. They have a program that's funded by MPS to provide after-school support. And so we will have a therapist there to work with young people and then also with their families as needed. And that's a 2-year pilot project that we're getting funds from Greater Milwaukee Foundation, as well as grant funds from Milwaukee County's ARPA task force. Our final approval is expected in March. And so we hope to be live before the end of the school year with that one. The other partnership we're entering into is with the City of Milwaukee Health Department through their ARPA funding. It's a separate therapist where halftime they will be serving LGBTQ youth and young adults within the community. This came after some discussions with the LGBTQ Community Center around programs that they used to offer pre-COVID and that they were no longer offering, not because there wasn't a need, but because they didn't have funding. So that they will halftime be working with those young people, and then halftime they will be going into the homes of our Insights housing program and doing therapy there in the home, because what we heard from our clients very loud and clear was that they wanted access to therapy, but due to transportation and insurance and daycare, they were not able to access therapy. So by providing it in the home, we're hoping to break down some of those barriers. And really the goals of each of these programs are to increase access to mental health providers in underserved communities, equip young people with tools to resolve their conflicts and trauma, and then really strengthen relationships with our community and youth serving organizations. And then in terms around advocacy opportunities, there's a few here. So one, the first one's kind of interesting. In 2023, there was an Assembly joint resolution to proclaim January 2023 as Human Trafficking Awareness Month. It's currently available for scheduling, but obviously it's a month late. So the hope would be that because there is bipartisan support, that perhaps for January 2024, there could be a joint resolution proclaiming that a Human Trafficking Awareness Month. The next couple ones are all ones that Pathfinders and Walker's Point are involved in. There's a safe harbor bill that under this bill, a child under the age of 18 cannot be charged with prostitution because a child cannot consent to sex. If we were able to pass this legislation, it would align us with 30 other states. It does have bipartisan support over several sessions because this is a bill that has been reintroduced. It has very strong support in the Assembly, but it looks like, based on our conversations, it's going to face a challenge in the Senate, especially with a few senators in Waukesha County who have made it very clear that they want to kill this bill. There's also AB 284, which was from 2021. That bill extends the notification window from 12 hours to 72 hours from a child's arrival at the shelter. So the way it works right now, the moment that a young person shows up at Pathfinders or Walker's Point, we have 12 hours to get their parents' permission for them to enter the shelter. If they do not provide that permission, we are not allowed to have them in our shelter. And so really the feds are saying, that doesn't really work. We'd like it to be extended to 72 hours. It's been done in other places and been much more successful. But right now that bill only has support from Democrats. And then the final advocacy opportunity is expand mental health care and health care for unaccompanied minors. So in 2019, Wisconsin expanded to allow 17-year-olds to access shelter without guardian consent. 29 states allow unaccompanied minors to consent for their own healthcare services. So this is something that we would like to see passed in Wisconsin. With that, I just have contact information in case you're ever interested in needing to get referrals to us. Other than that, I think I'm done. DeShanda, it's all up to you now.
Excuse me for just a minute. This is Barbara. Do we want to take questions after both presenters speak, or do we want to take a minute for questions for Audra?
Possibly the one that's a question about safe harbor would be timely right now, but maybe other ones can wait till DeShanda's finished.
Sounds good.
You want to read that one, Barbara? Or should I?
Oh, here, I've got it. So what is the status of the safe harbor bill? Has it been introduced? Who are the lead sponsors? So my understanding, and sorry, DeShanda, tell me if I'm wrong. My understanding is it hasn't been reintroduced yet.
I think we had a meeting on, it was yesterday. The time is crunching. I believe Senator LaTanya Johnson reintroduced it.
Oh, great. See, that's what I miss one meeting and I miss everything. So
Yeah, it was just one meeting, literally. But yeah, Senator Johnson reintroduced it. So on March 31st, we'll be advocating at the Capitol. Was that suffice?
So just because you said that right there as well, what's happening on the 31st?
Oh, so March 31st, in partnership with the Wisconsin Association for Homeless and Runaway Service, what we call WARS, who both Pathfinders and Walkers Point is contracted with. We are in partnership with them through our MERA program. So we have a MERA member serving in each of our agencies to provide additional support to our staff and our programs. And so they also throughout the state have partnerships with other shelters and homeless youth serving agencies. And so we are doing on-site in Madison at the state capitol, going to be advocating with our legislators to say that this bill should basically represent that young people should be referred to child welfare when there's harm or violence that they're experiencing, and they should not be legally allowed to be charged for prostitution as minors, just because they're in situations that they don't actually have permission, as Audra said, to consent to. That help? And then we'll be doing some more advocacy after March 31st, just to educate aldermen and other legislators and representatives around the work that both Pathfinders and Walkers Point really have to spearhead and lead as the only two homeless youth serving agencies here in Milwaukee, and just making sure that they're aligned with the unmet needs that our young people are facing. So that's information that we'll be sure to share out to or Barbara or whoever can share that out to this group.
Thank you, DeShanda. You can go ahead. Sorry to have stopped you there, but you can. It's all yours now, DeShanda.
Oh, no, that's okay. All righty. So I have. Am I able to share my screen? It's not happening.
I will give you permission. Sorry about that.
Thank you.
Just give me 1 sec here and you'll be good to go. There, should be all set.
Okay. I think I'm doing this right. Can you all see this? Pathfinders overview sheet?
Yes.
Yes.
Thank you. Okay. Okay, so Pathfinders has been around for over 50 years, since 1970, and our mission is to empowering youth and changing lives. And our vision really lies in making sure that youth are at the center of the care that they receive and that they feel safe, healthy, and are getting access to being independent, successful, and really valued. And so that it doesn't feel just like a service, but it feels like a community that they get to thrive in and feel empowered to make their own decisions. As this population that we work with, a lot of times they are in the community making their own decisions and really trying to determine and figure things out for themselves. So I'll go through our categories of services that we have here. Our supported housing team can serve up to 45 young people, including their children, in a scattered site housing model. We're able to provide case management for young people as young as 17, as old as 25, whether they're receiving a Section 8 voucher, they've experienced sexual violence, have aged out of foster care, identify as LGBTQ+, or just at a transitional age and are ready for what it means to move to the next step and become independent. We use a housing first approach to be able to support these young people, because we see housing not as a reward, but as a basic human right. From that, we also have our runaway and homeless youth services, which is all that we do, but very specifically, our oldest serving program is our youth shelter. Very similar to what Audra described. We are the second of the 2 youth shelters here in Milwaukee. So we have 8 of the 16 beds that are available to young people as young as 11 and as old as 17 years old. We also have our street outreach component. So in the community here in Milwaukee, young people identify areas that were high in need, high in risk. Perhaps these are people that may not feel safe trusting services, systems or professionals, but they still need access to basic needs. So we have a street outreach specialist, a therapist, and an MERA Corps member. They go out into the community and they're able to provide basic needs services as well as sexual health support. That could look like food, seasonal clothing items, things to support parents, as well as sexual health demonstrations, condoms. And the goal is to be able to coordinate and make referrals so that they can go in and access services that will meet their need, and that they're just not out in the community or on the streets without actually getting their needs met. So the hope is that we can refer them into something like our drop-in center, which is our on-site and home base for our street outreach team. Both programs serve youth as young as 11, as old as 25. And similar, the drop-in center provides basic needs services. Because it's an entire site, youth can come on site and they can take a shower, they can get access to a kitchen and make food and eat whatever food's available. They can store their things in a locker room. A lot of times they're carrying all of their belongings with them, or their belongings are in places that they don't deem safe, and they're used to make them feel less than. A lot of times we hear young people really happy that they can store their things at our site, because people will burn and mistreat their items just to make them feel like they have to depend on them. Then they can access clothing items, hygiene, and all of that at our site. So if you've never been to our site on Holton Street, it is an amazing site to see, to really like get a visual of the services that young people are receiving. And anyway, it's always the best practice if you've made referrals here to just kind of know like what that referral in-game looks like. But they have access to showers, case management, as well as employment education. And then there's also a therapist station in the drop-in center as well. We also have education component. So in partnership with Milwaukee Public Schools, Pathfinders has Southeastern Education Center, which MPS calls a behavioral reassignment middle school. We have a really trauma-informed approach with this middle school. A lot of these scholars are they are court ordered to this school because they're getting expelled from their original MPS placement. And this is kind of their last chance to re-enroll and get back into their regular education and studies. We also have a therapist upstairs, a psychiatrist upstairs in our school, a social worker. And there's a lot of collaboration between our middle school and our drop-in center, street outreach team, and some of our other services, because we recognize that that middle school and that level of need that they may have is a source for young people that are at risk of facing instability or who are currently experiencing instability. So a lot of times they may come in, they may not have a cold, they may not have ate, they may not have been able to take care of their hygiene. They get to do all of that and still be able to attend and focus on their education. It's so beautiful going up into the school. So our drop-in center is on the first floor and the school is on the second floor. And going up there, you even hear students saying, like, today is a great day to have a great day. Today we're leading with love and compassion. And there's a lot of restorative practices that happen in the school so that the scholars are learning to problem solve with one another in a really healthy way. And then they can maintain a safe environment while they're getting their education. We also have clinical services. And so, as I said, we have therapists in our shelter, street outreach team, drop-in center, as well as in our school. We also, with some up and coming funding, we'll have a therapist that's specific for our housed youth as well. So clinical services also includes our partnership with Wraparound, our Comprehensive Community Services, which is also called CCS. So this is our most unique service that we provide outside of the school because it is court ordered and all of our other services are voluntary. The clinical service piece with Comprehensive Community Services, our CCS team, that is a fee-for-service program. So the care coordinators and ancillary providers are in the community working with young people, using a trauma-informed approach, using motivational interviewing, and really being person-centered in the way that Pathfinders does, and making sure that they're getting their mental health needs met and developing life skills and having a supported transition into adulthood. Then we also have our anti-sexual violence services. So these are advocacy as well as therapy services for young people who have experienced or at a high risk of sexual abuse, exploitation, and trafficking. In this department, we can see youth as young as 6, as old as 25. This service also includes after-hours collaboratory. It's called the Collaborative Rapid Advocacy for Young People. We call it CRAE. So this is an after-hours service that is specific for this population of young people who are at high risk of sexual abuse and exploitation and trafficking to still be able to access legal and medical accompaniment after hours. As we know, a lot of professionals are done with their day about 4:30, 5 o'clock. We have volunteers from all across the city, from different nonprofits, community leaders, different systems that are part of this on-call volunteer support. And so they pass this phone around. There's also internal staff here at Pathfinders that are a part of this on-call after hours. And on that phone, youth are calling, people are making referrals. And basically, if they need for a person to come out and accompany them to a legal accompaniment or medical accompaniment, we have someone available to them. And it was really, really capturing an unmet need that young people identify. We have a youth advisory board that is a part of this collaborative and a part of these anti-violence services. They train and provide us with best practices on the best ways to support them when they're dealing with these situations and these challenges. They let us know how they need to feel, or maybe how an experience did, maybe it went wrong, or maybe there were some mistakes made, and they really help us to improve in how we serve them, because this is their situation that they need to have power and choice over. So then we also educate them on their rights. And it's a really big deal because it's really hard to access services and support for young people when all of the businesses and the agencies are closed. So we are basically centering our work around what our youth advisory board, as well as our youth action board. We have 2 youth leadership opportunities here, outside of just on a day-to-day basis, youth are able to give their input and give their feedback. And we take that to make sure that whatever funding we're getting, whatever services we're providing, that we're bringing them to the table and we're talking about what it is that they feel like needs to happen, what it is that we can wait on. A lot of what we have as far as the therapists here in each service area, that's something in 2019 that youth told us that they would like. So I've been at Pathfinder since 2011, and they didn't even want to hear the word social worker. And so by 2019, we had done some exposure with law enforcement, with medical providers, attorneys, and other systems people, and brought them in so that youth could really experience them as people. And when we had our focus group, young people started to say, I really want to talk to a therapist, but in a non-traditional way. They wanted to be able to have access to a therapist for de-escalation, for crisis intervention, for referrals to even better, more long-term care, and being able to stabilize themselves mentally. And they were very honest and open about their own mental health challenges, which we hadn't heard, for a very long time. We had respected meeting them where they were, and youth began to feel really safe, letting us know that that's a professional that they would like to have around. So we created these trauma-informed care therapist roles. We always had a therapist in our shelter, but we've become more intentional about what the therapists look like in our other service areas in their specialty, so that youth can access them as they're accessing other services, and they don't have to wait, and they don't have to pay, and they don't have to do any certain number of sessions to be able to access them. Something that's really amazing is that a youth that aged out of our services some years back, probably about 8 or so years ago, is now on our board. And so we have that lived experience and that youth voice at a higher level now in our agency. Youth also use their voice in hiring staff. So any staff that provides direct service here at Pathfinders, a young person has been a part of that interview and weighed in on how they feel other young people would respond to them and how safe they feel like those adults are. And then, of course, in our housing model, we give youth choice and where they want to stay. However, we all probably know this, that, there's a lot of restrictions on housing in Milwaukee, and it's unaffordable. And a lot of the affordable rents are in neighborhoods that youth are trying to get out of and don't feel safe in, or are part, or their businesses ran by landlords that are not respecting the dignity of the people that are staying in those places. So we listen to all of that. And then all of our services are voluntary and free. Again, the only service that isn't voluntary is Southeastern Education Center. Outside of if a scholar just decides not to show up. The issues that impact our work is that an estimated 15,000 young people aged 25 and under experience at least one episode of homelessness annually, with hundreds, and I believe on average, it's been about 300 young people on the wait list for housing support. 1 in 3 youth aging out of foster care will be homeless within 2 years of exiting the system. Homelessness leaves youth and young adults vulnerable to exploitation. Another reason why this safe harbor bill is very important. Within 72 hours of experiencing homelessness, 1 in 3 youth will trade sex to meet their basic needs. Then we find that youth become criminalized for trying to meet their basic needs, because a lot of what they have to do is, beg, borrow, steal, or do unforeseen and very drastic, violent, and sometimes risky and dangerous things to be able to get their basic needs met. 21% of homeless young women and 10% of homeless young men have been trafficked for sex, with even higher rates among the queer population. And Milwaukee is known as a national hub for human trafficking. We get an F based on our laws that support youth trafficking survivors. Another reason why at Pathfinders and Walker's Point, it's very important that we are advocating and we are representing our young people. And we will be taking young people to our March 31st Advocacy Day, because they are really excited to be able to stand up and use their voice for their peers. And that's something that we've been prepping these young folks on. We also know that poverty and racism are at the root of young adult homelessness. 1 in 4 children live in poverty, with 3 times more likely for Latino and 4 times more likely for Black children compared to white children. More than 27% of Black families in Milwaukee are living below the poverty level, with a percentage nearly 5 times higher than white families. So these are the issues that impact our work. Also, just like I stated before, the amount of weigh-in that youth provide to us, amount of feedback and youth voice that we respond to, it really helps us to determine how we need to be restructuring our foundation and our infrastructure as an agency, which has remained consistent. But Pathfinders has been lucky enough to be able to grow and enhance its services during a time where a lot of businesses couldn't thrive. But the unmet need, it really spoke to us needing to remain open during COVID. We were unable to close. I believe the drop-in center may have closed 1 week during COVID-19 pandemic, the declared one. And other than that, our staff have been boots on the ground and been working full force. I know our shelter did have to go down to 4 during the pandemic, and so that was really hard. However, we did see that a lot of young people were outside during that time. So then that was caught in the drop-in center, street outreach, and some of our other services. So we have this wraparound care model. It's not on a positive basis because of the type of work that it is. However, it is definitely, according to young people, meeting the need that they've identified, that values their voice in their decision making. And that's it.
Do you want to open up to questions, or do we have any in the, I don't see any in the chat immediately. I have what maybe while people wait for a question, but I was wondering, DeShanda and Audra, my sense is that youth homelessness is semi-invisible to a lot of Milwaukee because youth find, couches and other things. It's certainly not like the, people you see on the streets panhandling or otherwise. And so I just wonder if you could give a sense of the scope of the problem. I know people, anybody in MPS will know that there's a lot of kids that are homeless that, bring their stuff to school and whatever, but I don't know that many people are aware. So I don't know, you may have covered it, but what are the numbers we're dealing with and how close are we to being able to serve the needs of housing and clinical services?
So I know in NPS is always increasing at that 15,000 number. We have an estimated 15,000 young people under age 25 experiencing at least 1 episode of homelessness on any given night. It can be about 500 young people experiencing homelessness. And the thing about it is that it's invisible because young people can they're really to give them credit, they can figure out where to go. They can figure out and problem solve and plan places, which could also create these other risks for them that we had both mentioned and talk about. But they present very well. Like, some young people are still going to school. Some young people may look and appear as if nothing at all is going on with them. You may see some folks outside. For the most part, they're not trying to be seen or noticed as someone that needs help. And so we open the definition up a lot to how they define their home living situation. If they are in between houses or living in a hotel, or maybe they live with mom and dad, but they're always, getting put out, or they don't feel safe, so they feel the need to always run away. So the level of, or the measure of like what it could look like is so all over the board, because it is the instability part that youth define to say, like, I need help because of this situation feels unstable. And there are some young people that we see that are like, well, I'm good, I can stay with my mom, but she's not able to make ends meet, and we can lose where we're staying at any moment. And then that young person feels an obligation to be able to provide for that household and that family, and then they're at risk of more stability than they're already facing. So it is, I believe there's been messaging out that homelessness has been down to like smaller numbers of like, 5 and 10 and 15. And that really speaks to like the chronic homelessness, like the amount of time that someone has been literally living on the streets, not meant for human habitation. So we're always close to eliminating that problem. But as far as people, I mean, when the issues that impact the work are racism and foster care and those types of things, I don't know that we could ever really cap how close we are to eliminating the issue, because those are systemic macro level issues that we're hoping legislation can help us to change. But there are some things that we're not even at the service of scratching, like racism. So it's just a hard call as far as like eliminating the issue, but the numbers are always increasing when it comes to NPS from what we've seen.
Audra, I don't know if you want to add anything to that, but I wanted to maybe also throw into a couple of questions here. One is housing resources. I know both agencies try to provide housing, but in terms of wait lists, I mean, if somebody working at an agency or legal aid or someone like that, or public defender is aware of somebody needing housing, what does it look like in terms of supply or barrier or just wait lists and that sort of thing? And the other question I had was, do you provide housing that, say, for a young person with a child or children?
Yeah.
Also, if Audra wants to do the other question, the broader one about just what you see as the scope, please feel free to answer that.
Yeah, so DeShanda said there's usually MPS says there's around 15,000 young people that are experiencing some form of homelessness. And then I know in 21-22, out of those, they identified almost 900 that were unaccompanied youth. And that's just an MPS, which I think we got to keep in mind, because we actually get a fair amount of adolescents coming to us to shelter that are from charter or parochial schools that aren't even counted in those numbers. And then, so in terms of housing, yes, we absolutely will take the family unit, however it exists. So if that's a young person and their child, or a young person and their partner, or whatever the case may be, we're going to call them, if they call themselves a family unit, we call them a family unit. And so in terms of the housing options, though, that's where we're getting pretty dire, because obviously if you're talking about 816 MPS unaccompanied youth, well, we only have 16 beds between the two of us in all of Milwaukee. So obviously there is a discrepancy there. But then when you're talking on the more long-term housing outside of the shelter, again, that's where we're getting into, when I say that there are 200 young people on the list for my housing program, that goes for everything with DeShanda's as well, because we use coordinated entry to try to get those higher acuity young people in more quickly. We have a joint sort of, if you will, waiting list. And really where I think that our community has done some great work, but it's also really difficult for our young people, is as we've moved to this coordinated entry and this very high acuity need, some housing could in theory be open to our 18 to 25-year-olds because they're considered adults, but because they don't have that chronicity, so that long-term, like you're talking about in the tent cities and that sort of thing, they're never going to score high enough to get into those housing programs that are for all adults. So they're really only going to score to get into Pathfinders or Walker's Point. And so that's where we have some more work as a community to figure out, like, while they may not score as high because they haven't been outside for 10 or 15 years with these co-occurring conditions, we also know that these are the young people that if we serve them and serve them well, we can prevent them from being that person that's been outside for 20 or 30 years with all these co-occurring conditions, if that makes sense.
Yes, it does. And we have just a few more minutes here. I guess one question I'll just toss out, just because we have a lot of agency and advocate people here. If somebody is working with an advocate on some other issue, and they have someone that needs help, is there particular best way you prefer for someone to, whether it's a lawyer or an advocate or peer advocate or something, to help somebody access either program, or is it that would the youth themselves make a direct contact through a system, a way I'm sure is on your website?
Here, I believe both, but we have a no wrong door approach. So basically, if they come into the drop-in center, or they call the drop or the shelter, or they call street outreach or run into street outreach, either way, we can support. It's just all about that youth consent. If there's a professional or an adult that's supporting them, that's out of our age range, to be able to communicate with them, we would just need that young person's consent. But they could access these services however it is convenient, as long as we have somebody available on the shift.
Barbara, I see you've had your hand up.
Yes, thank you. Audra and DeShanda, first, I just want to say how grateful I am for the important work you're doing in the community, and against such challenging odds with the shortage of resources and the unmet need. It was a lot to take in. I wondered, in terms of the policy agenda, with this being a biennial budget year, how you will be moving forward as the budget comes out with putting together your policy and budget agenda. Will that be like through the shelter task force, or is that something, because of your focus on youth, that your agencies work on together? Just wondering how we might learn about what your priorities are and see if there are some things that we might be able to include in our mental health task force agenda as well.
So Audra, I'm not sure. Oh yeah, go ahead.
No, that's okay. I was going to say shelter task force is always a good way to go because we're all involved in it. And we have just undergone a pretty significant strategic planning process to start to identify some of these gaps in our system. So I think that's a good place to go. But as DeShanda said, we're involved with the WARS group, the Wisconsin Association of Homeless and Runaway Youth. So as we become more, as we transition to be more advocacy based, I think that there will be a lot of places where we can like email and say, hey, can you get this out to your listserv? This is important. For us personally, I feel like the only thing that Walker's Point's really looking at financially this year is getting the Milwaukee County ARPA Task Force to approve our ARPA funding in March, but it looks like so far so good. So.
Thank you. That's very helpful. So I do get the shelter task force emails, and they're a great coalition. So we'll try and coordinate with them. And also, maybe Audra, you could email me with information about the Wisconsin Organization of Homeless Youth. Or I'm not sure
absolutely.
if I got the name right. So I'd like to know more about that. Great.
Can do.
Wow, you two are doing amazing work. Thank you.
Thank you for letting us come and speak to you all.
Thank you both very, very much. Look forward to having you back again.
Stay in touch.
All right. I'd like to move on to our next speaker. In honor of Black History Month, we have with us Montrèal Cain. Montrèal Cain is a member of the steering committee for the Mental Health Task Force, and he's the founder and director of MERA, Wisconsin, and he has put together a program on Black pioneers. So I'd like to welcome Montrèal Cain.
Hello, everyone. Today's educational workshop is bidirectional, which means I can talk to you and you can talk to me. So just by a little show and tell, let's see how many people are going to turn their cameras on today. Okay, we got one. All right, there's two. Okay, 3, 4, 5. Keep them coming. Keep them coming. One of the things that I loved about DeShanda's presentation is she spoke truth. I'm a retired educator and teaching for MPS. Hey, Paul. Okay, Carla, you guys were okay. That's what's up. You guys are unmuting. When I retired from teaching, it was because of situations like this. Nobody would turn their cameras on. I went from being the coolest teacher in the world to not being able to feel the love from the young people. And so to really echo what I just heard, I remember doing restorative practice circles every Monday and every Friday. That's how I found out about the needs of the young people. And so one of my favorite young folks who now is a private in the United States Air Force, moved out of Milwaukee, really started thriving, moved back to Memphis. His nickname was Memphis. It didn't start that way, right? In a restorative practice circle, we found out that this brother was living in a car with 6 other children. And when I tell you he was the most well-mannered, well-behaved, well-spoken guy, it's these things called waves. I don't have them anymore, but my son got some waves. We call them the 360s. His hair was immaculate. So you would never know that he had this challenge, right? And the way he carried himself, he always had a fresh white t-shirt on, you know, his pants fit well, but this brother was indeed living in a car. And this is at like 14 years old. And I remember giving my students business cards and saying, hey, this is your get out of jail free card. If you're ever in trouble, no matter where you are, no matter what time of day it is, I will show up for you. And so it was one of those moments where he came to me after class and was like, do you really mean what you said? I said, yeah. I said, what's going on? He just had his head down. He said, my sister, she's 6 months old and she has a bad cough. This is what led me to find out that this gentleman was living and experiencing homelessness. And so just being able to unpack that conversation, I was on a call yesterday with the Department of Health and Human Services, and I was expressing to them that if we can find more credible messengers in the school systems, teachers who got, you know, a little bit of swag, maybe they got a chain like Mr. Cain, the kids think they're cool, right? Individual teachers who may not be positioned as psychiatrists and psychologists or school social workers, but the kids trust them enough, knowing that they're credible messengers, to tell them what's going on at home. And so I really just enjoyed that last presentation. I don't know if Jeremy is still here, but we will be going to an event together just around the 5 o'clock hour. So I won't go over my time. I'm very measured with my words today, but I'm excited to be in front of you all because as we get ready to enable screen share, I'll be able to share with you some of the amazing inventions that has come from African-American people, man. I saw a video on TikTok and it was one of these days where a person walked through their house and showed all the things they couldn't do without some of these inventions and with people being able to pioneer. So without further ado, I'm going to go ahead and give it to you guys. Stay tuned. Remember, this is a bi-directional conversation. So if I happen to call on someone to read, all right, it might be you. So be ready, okay? Here we go. Take a journey with me with Black pioneers and Black inventors. One of the things that I'm really excited about is as I started doing discovery work to better understand who these individuals were, I got a better chance to even understand how I function, how I am able to thrive in a space and learn that some of the things that are necessary may not have always been reputable as far as patents and things like that. But for these individuals, we're going to start with Mr. Bass Reeves. Mr. Bass Reeves is an American law enforcement official, historically noted as the first Black deputy, U.S. Marshal, west of the Mississippi River. He worked mostly in Arkansas, Oklahoma, in his territory. And during his long career, he had a record of more than 3,000 arrests of dangerous fugitives and has unfortunately shot and killed some people in self-defense. Why do we start out with Mr. Bass Reeves? Because as we get through this process, there's a more excellent way to de-escalate and serve the vulnerable population. B.B. Moore Campbell. B.B. Moore Campbell was an American author, journalist, teacher, and mental health advocate who worked tirelessly to shed light on mental health needs of the Black community and others underrepresented communities. She founded the NAMI Inglewood chapter, which is basically in a predominantly Black neighborhood, created different spaces to talk. This just makes me feel like I should have added a slide about Dr. Leah Knox at Black Space. Throughout her time as an advocate, Campbell made her way to DC on June 2nd of 2008 to Congress and formally recognized BB Moore as a National Minority Health Awareness Month. She was part of that process. She helped people who were underrepresented in groups really just deal and cope with mental health. And guess what? It's Black History Month. So understand that so many different stigmas that are facing different groups of people still are challenges. But with these pioneers, we learn how we continue to persevere. And before I get going to Charles Drew, I'm going to take a couple seconds because I timed myself to give you guys an anecdote. All right. Is that cool? Awesome. Montrèal said it's cool. It's cool. You guys, I stood in the rain today for about 2 hours before I came and gave this presentation. I was able today to do a co-response with the Milwaukee County CART team, the Milwaukee Police Department, and help with a domestic dispute, as well as something that could have been considered a violent situation. And when I tell you, I was so excited to do this presentation today because the lived experiences that I'm sharing with you, I want you to go back in your mind. And when I say some of these dates, think about where we are today versus where we've come from, and understand that the playing field of services are constantly growing to make equitable outcomes. There are people on this line right now. Say hi, Barbara. Say, hey, Mary. These are some of those freedom fighters that I've learned have been doing so much work in the tail end for us to be able to tell these tales of pioneers. These are folks that a lot of times we don't give them the credit that they're due. And what we call them are, does anybody know? It starts with the letter A. Allies. So while we're talking about Black History Month, and we're talking about some of these things, understand that there are strategic partners that have been at the forefront of a revolution for so long. As we continue on, that was Montrèal's anecdote. It was about 36 seconds. I'm doing all right on timing. We're going to learn about Mr. Charles Drew. So Mr. Drew, just a second. Mr. Drew basically was in a situation where every 2 seconds he realized someone in the U.S. needed blood. Thanks to Charles Drew, the blood is now available. Drew was a physician, surgeon, and medical researcher who worked with a team at Red Cross on groundbreaking discoveries around blood transfusions. So think about blood banks. As a matter of fact, shameless plug, we got a health and wellness event where we're going to be doing some measuring of the heart rate and hypertension this Saturday from 10 to 2 o'clock at the Running Rebels Community Organization, 225 West Capitol Drive. But without Mr. Drew, we wouldn't even be in a position to understand how do we capture the needs of the people by inventing things that can retain the blood, keep it at the right temperature, and come up with these different blood banks and plasma and create different programs. He invented this process, and he was named Pretty Charming. It was one of those things that with Mr. Drew, him working as a doctor and working in his field, being a researcher, he was able to get institutional knowledge. And when you work into certain fields, you're able to kind of cross-pollinate. How can something that I learned in this area help me now in this space? Mr. Drew eventually resigned from his position at the American Red Cross over the instance of adhering to this policy. It was in 1950. All right, it's 2000 and what? 2023. You guys have to write in the chat, but in 2023, we go back to 1950 before Red Cross finally recognized all blood as being equal. Let that marinate for a second.
Wow, that is shocking.
Yep. We also have Claude McKay. Claude McKay, born Fetus Claudius. This is quite a name. Born Fetus Claudius McKay in Sunnyvale, Jamaica in 1889, was a key figure in the Harlem Renaissance, a prominent literary movement in the 1920s. His work ranged from vernacular verses celebrating peasant life in Jamaica, to poems, to protests, to racial and equitable inequalities. When I first traveled to, I think I want to say Montgomery, Alabama, I first heard about Claude. And when we think about, I'm in a fraternity called Kappa Alpha Psi Fraternity Incorporated. Shout out to the Noops, 1911, on the campus of Indiana University. we used to talk about how the brothers of my fraternity would sing songs, that when there were so many different things going on during the civil rights movement, people were discouraged. So when you think about the protests, the radical power, people singing, people being able to use their voices to provide comfort, in addition to all of these things, Claude was in a museum for his music contributions as well, and he was considered a crooner that brought comfort to the people. We got my man, Charles S. Lewis Baker, an American inventor who patented the friction heater. Baker was born into slavery on August the 3rd of 1859 in Savannah, Missouri. His mother, Betsy McKay, died when he was just 3 years old. Let's talk about trauma, right? So born into slavery, mom dies when you were a child. His father was employed as an express agent, and once Baker turned 15, he became his assistant. Baker worked with wagons and linchpins. He had his interest sparked in mechanical science. Now, take a moment, because just like when I do research, I always try to find something that connects. When I was 3 years old, I used to go to work with my father at GE as he worked on heart defibrillators. I didn't know what my dad did. I didn't know that an engineer and a janitor wasn't the same thing. I remember one day he had to educate me that it wasn't. These were two big words. My great grandfather owned a janitorial service here in Milwaukee, and he used to go to doctor's offices and clean up. But it sparked my interest in tech really early, because I would get on the assembly line and I would use a soldering gun to put together different wires and whatnot. So I can only imagine how this exposure at such a tender age got Mr. Baker into the space that he is in today. The Friction Heater and Boiler Company he established in 1904 in St. Joseph's with Baker and his board of directors. The company worked up to $136,000 in capital, equal to nearly $6 million in 2022. The representation matters. And when you have exposure, you can have different things. We often talk about the Kia Boys, and there are certain individuals. I have a young man that I mentored, had a loved one who dealt with bipolar disorder and schizophrenia. And I remember one day he went into the library at the school I was teaching at, and he was programming a robot, one of those Spiros, and he had it going this way and that way and going through the different library, let's just call it aisles. And he was able to get it to change colors. And eventually that conversation turned into him thinking about getting into computer programming and things like that. When we have representation, it's so important, especially when we start young with children, because it makes a difference. And it was in 2002 when the State Assembly Bill 250 for the cost out for quality education talked about children being able to go to schools that have well-kept facilities and adequate staff. And we've gotten so far away from it, you all. We've gotten to a place where sometimes we might remove home economics, or we might remove aerodynamics or auto shop. So we got to get back to having that representation. Now, E. Childs in 1969 helped found the Association for Women in Psychology. She was a founding member of the Chicago Gay Liberation Front. In addition to being a leader for women in psychology and the LGBTQ plus community, she also owned her own practice in which she provided therapy to LGBTQ plus folks, people living with HIV and AIDS, and other marginalized members of her community. She practiced feminist therapy and centered her research and work around the experiences of Black women in feminist history. Shout out to you, sister. Now, Elijah McCoy, often regarded as one of the most fabulous Black inventors ever, McCoy was accredited for over 50 inventions over the span of his career. In an effort to improve efficiency and eliminate the frequent stopping necessary for lubrication of trains, McCoy devised a method of automating the task. So for some of you guys, you got in your car, engines working, pistons moving, you got out the cold, you pumped your gas prices are down. Shout out to that. There's this process that you need in an engine. I'm one of those guys that have always prided myself on learning how things work so I can either make them better or take them to the next playing field. And so when you think about the pistons in the engine and you think about the friction of the pistons, think about that locomotive, think about that train that's going, right? Well, somebody manually used to have to lubricate that. Mr. McCoy made it so that there could be an automation process. The lubricating cup met with an enormous amount of success, resulted in orders for the railroad companies all across the country. It was so popular that when other inventors attempted to steal his idea and sell their own version of the device, the company was not fooled. They wanted the McCoy device. They wanted the real McCoy. Ever heard that phrase before? That's where it came from. Now, Jesse Ernest Wilkins Jr. Mr. Wilkins Jr. is one of America's most important contemporary mathematicians. At the young, tender age of 13, he became the University of Chicago's youngest student. Wilkins continued his studies there, earning a bachelor's, master's, and eventually earning his doctorate degree in mathematics. One of the things that I love is his greatest contribution to scholarship was the development of mathematical models to explain gamma radiation and his other work on developing and shedding against gamma radiation. Understand that when we talk about radiation, there's so many different people. I know it's not October, but shout out to anyone that has survived and battled any form of cancer. There's different forms of treatment. And we've learned that through different radiation, now they even have it in the form of pills. They have a liquid form. They have acute medicine that can help people. Taking a brief moment, another anecdote, I gave myself 36 seconds. I was able to do some work with Pfizer Pharmaceuticals about 7 years ago, where I went to the Big 10 top consortium schools, worked with clinicians, researchers, doctors, and really just started to understand what was the importance of African Americans participating in clinical trials. And what I learned was because of situations like the Tuskegee experiment, where individuals who thought they were getting a placebo and a sugar pill were really being injected with things like syphilis, right? Completely different. They lost trust. But when you have guys like Mr. Wilkins who are at the forefront as a pioneer saying, you know what, we're going to use math, we're going to use basic principles, we'll be able to protect you from some of this innovation. It's so important, again, to bring it all back into what? Representation. I think it was, I can't think of his name, the brother from Shark Tank had the company called FUBU, For Us, By Us. Miss Gladys West is an African-American mathematician who worked alongside fellow engineers at the Naval Support Facilities. West's work contributed to the development of GPS. Come on, y'all, global positioning system. So when you you on Waze, you're on Google Maps, you're on iPhone. A lot of these Apple Maps, a lot of these things wouldn't work if we didn't have these first inventions. The GPS technology is used across every industry, from tracking humans to animals to stats and nav, social media, Google Maps, and local deliveries. You can thank Ms. Gladys for that. Herman George Candy. Mr. Candy was a prominent Black clinician and social psychologist. He was accredited with being the first psychologist to study the influence of rapport between an IQ test proctor and subject, specifically researching on how the race of a test proctor can create bias in IQ testing. What does that mean? That was hard for me to read too. What was the bias? When we're looking at an IQ test, we're looking at different proctors. We're in a day and age right now where I'm pretty sure his work is helping in artificial intelligence. There's different algorithms and there's different codes that are being created to help equality and position just fair opportunities for people. And there's also some that aren't. Well, what he wanted to do was look at the rapport between the IQ tests and those different proctors. He also helped to provide the understanding for test environments that were suitable to help Black students succeed. As an educator, I remember calling my wife. We weren't quite married yet. And I'm like, hey, I'm talking to these administrators. I want them to understand and believe that some of the best practices and principles for our young people to thrive is when we change their environment. She said, oh, that's called environmental learning. Wait, so like when that one student that usually would have hung out in the hallway, saw the little cool LED lights like behind me, listened to the music, found they were in my classroom, opened up their laptop and got their work done, that's called environmental learning. And my wife told me, absolutely. So she was my study a lot of times when I talk to administration about innovative ways to be able to reach the young folks. As we keep going, are there any questions? We got about a whole lot of slides left. So I just want to take a brief moment, look you guys in your eyes. For the ones on camera, appreciate you. Pete, I see you. Carla, I see you. Any questions, comments, concerns so far? Looking in the chat. All right, I would like to learn more about eChild's. Okay, awesome. Welcome back, Mary. I like that outfit. Is that your Valentine's Day red? You look good. Do you got some red glasses too? Listen, y'all don't sleep on Mary. She be ready. I like the pink ones personally. As we continue on, guys and gals, we have Isaac R. Johnson. He created the foldable and detectable bicycle frame. He submitted his invention for patent in 1888. The aim was to enable people to take their bikes on vacation and to allow them for easier storage. If you've seen a lot of those different new bikes that come up in the ads on Google and Instagram and all those other things, he had the first patent for it, which is really cool. And so now we're looking at 2023 at an invention that came out in 1888. 99. James P. Calmer. Dr. Calmer is the Maurice Folk Professor of Child Psychiatry at Yale University School of Medicine, Child Study Center in New Haven, Connecticut. He is known nationally and internationally for his creation of the Calmer School Development Program in 1968 with Yale University School of Medicine. Question for the audience. Why is the year 1968 so important? What was going on in our country in 1968 where Dr. Calmer was able to open the School of Medicine? Excuse me, Dr. Calmer. Dr. Calmer has focused his career on improving school restructuring and has featured, you can type it in the chat, you might have a prize. I might show you what it is because I got like 5 of them sitting right here. This is, a little PBIS, Positive Behavior Incentive Solution. He's the co-founder and past president of the Black Psychiatrists of America. Dr. Calmer is the recipient of countless recognitions and holds over 48 honorary degrees. 48. Not 1, not 3. 48, like first 48. I know y'all be watching that. Dr. Calmer received a prestigious nomination by President Barack Obama to serve on the President's Commission of Educational Excellence for African Americans. Jen, let's talk about Jennifer. Jennifer is an esteemed professor of psychology at Stanford University. She is an expert on the consequences of psychological association between race and crime, and has done extensive research on the topics of implicit bias, criminal justice, and the educational system. And her work has provided the evidence needed to educate law enforcers in implicit bias training. In 2014, Dr. Eberhardt's work earned her famous MacArthur Genius Grant Fellowship. Shout out to her. Langston Hughes, who is this guy? Was a central figure in the Harlem Renaissance. He was the flowering of Black intellectual, literary, and artistic life that took place in the 1920s in a number of African American cities, particularly Harlem. A major poet, Hughes wrote novels and short stories, essays, and plays. Can anybody in the chat just tell me a random line from a Langston Hughes poem? Take your time. I will be reading. Louis Latimer, inventor and engineer. Louis Latimer was born in Chelsea, Massachusetts on September 4th, 1848. He collaborated with science greats Hiram Maxim and Thomas Edison. One of Latimer's greatest inventions was the carbon filament, a vital component of the light bulb. His invention did not stop there. Working with Alexander Graham Bell, Latimer helped draft the patent for the Bell's design of the telephone. The genius also designed and improved railroad car bathrooms and an early air conditioning unit. Y'all can thank Latimer for staying cool because it'd be hot in the summertime here. So the next time you are escaping on a hot day inside your co-house, don't forget about Mr. Lewis. Let's talk about Lisa Goldbelter. Now, I'm glad some of these people aren't here to hear me say their names because I might not be saying it right, but y'all keep rocking with me, okay? Give me a thumbs up if it's all right. If you've ever enjoyed an animated GIF on the web, like the ones in the amazing clips of kittens being scared by an enigma, and then having Lisa, you have Lisa to thank, right? So a GIF is basically one of those moving graphics where, like, if a person, puts their glasses up and it kind of jumps at your screen, or if you're on a Clubhouse and you want to have a reaction, you want a motion graphic moving around, Lisa brought that to us. And so understand that Lisa previously worked as the interim head of the BET network and ran technology products and business operations. Today, you can catch Lisa at the White House in the United States Digital Service. She is currently serving as the Chief Digital Service Officer for the U.S. Department of Education. Don't that just give y'all hope? Now, we got my man, Lonnie G. Johnson. Did you ever enjoy a water gun fight as a kid? Question mark. If you've ever had a water gun fight, go ahead and put a number 3 in the chat. Now, I'm not talking about this stuff that they have at the dollar store or Family Dollar. I'm talking about real life super soakers. I remember having the CPS 2500 with a big red tank on the back. I was the baddest mamma jamma on the block. Well, you can thank Mr. Lonnie Johnson for that. In addition to that, he wasn't just a toy maker. He actually worked in aerospace engineering for NASA, and will resume boasting as a stint with the U.S. Air Force while on the Galileo Jupiter probe and Mars Observer project. He has over 40 different patents, and he was able to get a patent in something called the GTEC, which stands for the Johnson Thermoelectric Energy Converter, which converts heat directly into electricity. But it was a squirt gun that he was most popularly known for. Now, listen, when I think about the future and how diverse some of these palettes and portfolios are, it makes me hopeful that we will continue to see innovation, because you could start in one place and you never know where you're going to end up, from the squirt gun to a thermoelectric energy converter, right? Let's see, who else do we have? Miss Marianne. All right, Miss Marianne. In 2023, Marianne Croak was inducted into the Women in Technology International Hall of Fame. A move that recognized her remarkable achievements in tech. Croak holds over 135 patents, primarily in voice over internet protocol. Now, does anybody know what a VoIP is? You can write in the chat. Some in other areas, and I'm going to check the chat too, because I did actually got some questions, and I do have some prizes, and I will coordinate with Miss Barbara and Miss Barbara as well as Mary to get them to you. So make sure you're using this chat feature. Remember, educator wants to hear from you. Today, Marianne is the senior vice president at AT&T. She serves as a mentor for women at AT&T Labs and sits on the board of the Holocaust/Genocide of Human Rights Education Center. So when you think of a VoIP, some of the students back in the day wanted to be able to use certain applications to like make beats. I remember during the pandemic, we couldn't get a license for Photoshop, but there was a student that had some type of software where they used the VoIP and was able to get that software on their computer, on their Google Chromebook. And so a lot of times it's considered an alternative internet solution. If you are trying to work in a banking institution, a lot of times the internet that you see is not the one that they use. She was the one for creating those alternatives. All right, we're going to take a break after this and open the floor for a couple of questions. We have Marie Van Britton Brown. Did you know the first home security system was invented by a Black nurse? I'm telling you guys, these pathways are very amazing. Meet Marie. Although she was a full-time nurse, she recognized the security threats to her home and devised a system that would alert her of strangers at the door and contact relevant authorities as quickly as possible. Her original inventions consisted of the peephole, a camera, monitors, two-way microphone, everything you see in the Ring alarm system these days. We have to thank Mary for that. So when you think about surveillance, home security, push button alarm triggers, crime prevention, traffic monitoring, Mary was the person who brought that to light and to the table. Let's do a virtual clap for our Black pioneers. Let's look in the chat. Are there any questions? And remember, when you guys talk to me, you know, I feel like I'm loved. I feel like I'm getting somewhere. Feel free to unmute. Who feels like some of this information was like, wow, I didn't know. I did my best to try and find inventors and pioneers, some that work in the mental health space, but some that also are just brought us things that people didn't know existed, right? Because a lot of times we're like, oh yeah, George Washington Carver, right? But we got to get past that. It's so many more. And so any questions, comments, or concerns? In 5, 4.
Thank you.
You welcome.
I appreciate the presentation. I appreciate just what you said, that it highlighted people that we may not have thought of or thought about otherwise, and inventions that we may not have even known that were invented by these great people. So I appreciate that. This is motivating me because there's more that we can do to make sure that our young people here know like the uniqueness of like, or the range of inventions that Black people actually initiated and took on. So that was cool. Thank you.
You are welcome. So I will make this slide available to Barbara. I burnt the midnight oil for you guys. I'm trying to tell you. I went to my graphics department and told them, no, like 5 times, but we got it going. It is 5:01 and I want to be a steward over our time. I'll leave you with this short video and that will conclude my presentation. Is that okay?
Montrèal, you cease to amaze me.
Teamwork makes a dream work. Couldn't do it without you. Here we go. And this was just filmed on Friday. You guys here?
Bro, you smart. That was the word I said the other day. Praise God. I feel you, but it's really go meet my brothers, man. You go to the regular speed change, Fraudestone, slides, Fraudestone. You just telling me who bought. I'll try to. That's on the morning. Oh, let's go.
Sit down. Take your seat, son. Take your seat. Take your seat. Take your seat. What's your name, son? AJ, who's you? All right. What's your name, son? Rashad. All right, Rashad. And AJ, my name is Mr. Reed, and I'm gonna need the class to settle down. All right. My name is Mr. Reed. I'm your substitute teacher for today. If you want to try me, try me.
Man, where's the video? Is somebody
Take your seat, son, or you're gonna be outside of this classroom. Now that I have you guys' attention, like I said, my name is Mr. Reed. I'm going to be your substitute teacher for today. Mr. Ward is out and he's sick. So can anybody tell me what have you guys been learning for the past week?
Learn about Black History Month?
Okay, what about Black History Month?
You were learning about some old lady named Rosa Parks.
Rosa Parks? Okay. Okay, what'd she do?
That y'all know, but just
That ain't no she bleeding, bro.
Okay, it's Rashard. What else did she do, Rashard?
What she did was she got off work and she was tired. She sat down on the bus like any other mad Black person off work would be. She sat down in the race neutral section, which the bus driver claimed to be a white neutral section. And then they called the police on her and she got arrested.
I'm glad you said that because a lot of people don't know that. Is there anything else you guys been learning about Black history?
We learned about how Martin Luther King started to civil rights movement and wrong.
Okay, sorry. Let us know how it really got started.
Martin Luther King didn't start the civil rights movement. It was a bunch of college students. They went into a diner, they sat down in the front, and they refused to move until they got service. They was attacked, punched, kicked, spit on. They got coffee throwing them, hit over their head with stuff, and yet they were the ones arrested. But just like an ignorant Black person like you to think.
Bro, nerd.
That's the name, Rashard. I'm glad that you guys are learning. If you guys been learning anything else?
We learned about the Underground Railroad.
Underground Railroad?
Yeah.
Okay. What about the Underground Railroad?
Ain't it that place that make our sandwiches or something like that?
Bro, wrong.
Hey, really? Rashard, enlighten us.
The Underground Railroad wasn't a subway or somewhere you went to go get sandwiches made. It was a way for slaves. It was a way for slaves to escape slavery. It was a way to get to the promised land. The only way it was possible because of white people named Quakers. They helped us get to the promised land by feeding us, hiding us from slave captors, and helping us get there by traveling us there.
That is awesome. That's absolutely correct. That's good that you guys are learning about a lot of different people that helped create Black history. But have you guys been learning about any current history that's been making today?
We've been learning about a guy named Montrèal Cain.
Okay, what about him? Somebody tell me about it. Anybody else know about Montrèal?
He's a mentor and he partners with the Runner Rebels youth team. But he created an app that's used on Apple Watch and smartphone called MERA that can read your vital signs. And like the acronym MERA stands for Monitor, Engage, Recommend, and Advocate. So first, they like if you're having a bad day or your heart rate up, they can like suggest a playlist for you that really help you. I tried it a couple of times. It's actually really helpful. And then they recommend, so like if that's not working, they recommend things like the breathing app and stuff. And for advocating, like instead of police showing up, there's a lot of Black licensed therapists that can really help you. And if that doesn't work, they can show up within 30 minutes to anywhere in Milwaukee.
That's great. That's great news to hear, man. it is important, guys, as young Black men, that we get educated. Because nowadays we getting false information about our heritage and our history. So it's awesome that you guys, Mr. Ward is teaching you guys about current history and Black American history, so we get educated and know what happened really in our lives to push us forward. Now, I'm going to give you guys a question. Anybody know the last school that was the last year and where the last school was segregated? Alabama.
And
All right, that's good. That is also correct. 2018 in Mississippi. So it is good to know that because we know where we're going and we can educate ourselves today. What's up? What?
Thank you all so much for really just entertaining this presentation, welcoming it. Representation matters on so many different levels. And as we continue to move forward, as a mental health task force, and shout out to the steering committee members for really making this possible, just understand while we have come so far, we still have a long way to go. And there's this phrase I like to say, it's called because of you, we can. So thank you guys for paving the way. I'm going to take 30 seconds to say, Ms. Barbara, thank you for finding members who can help support our efforts. Thank you for being a physical agent. Mary, thank you for introducing me to the mental health task force. As an African-American male, I had no clue you guys met. And I've been in this industry for almost 5 years now. So when you open your dorms and you extend your arms, it allows us to continue to do the work, to spread the good news and the messages. So thank you so much. Happy Black History Month to you all.
Thank you. That was amazing. You are such a gifted educator. You really made an impression on so many of us today. Grateful for your work, Montrèal.
Thank you, Montrèal.
It's been an honor and a privilege. Thank you guys so much. I know it's 5:08, so I don't want you guys to say I can't come back. I tried to be as close.
Keep coming back.
Thank you, everybody. Look at all the links on the website and on the agenda, and we'll see you next month. Thank you very much.